Social work, in the most simplest sense, is to improve the quality of life of people around you.
Empowering and advocacy.
Being a change agent.
Coordinated chaos.
I think social work is all about connection.
Just showing up for people.
Giving a voice to those who are seldom heard.
I think of social justice, advocacy, and helping others.
All you can take with you is that which you've given away.
I think social work is ultimately a collaboration between the social worker and the person that you're serving.
It's working with providers to advocate for the best level of care, collaborating with the interdisciplinary team, promoting continuity of care, assisting with discharge planning, and educating providers about alternative care levels and options to best meet the needs of our members.
I would describe it as holding space for others who might not have felt that they had space in this world.
I actually work for the Housing Task Force team, so it holds a little special place in my heart because we actually get to see our members who are in homeless shelters actually become housed, and we follow them throughout the housing process, and then after they're housed, we provide case management services to make sure they're connected to their resources in their community and their providers. So we get to see them throughout each stage, and it's very rewarding.
Every day feels like I'm changing everyone's lives, because a lot of people that we work with, both here and other places I've worked at in the past, they didn't have a lot of people who could look out for them and provide them some help.
Every day, I have the privilege of helping children with serious behavioral health challenges connect to services that could change the course of their lives. At Metro Plus Health, I work alongside their families, offering support and guidance as we work together to build brighter futures.
People have told me that, having someone to talk to help them navigate the challenges in their life and provide them with resources in a time when they felt so alone and they felt like they didn't have anyone, and that I was that person for them.
My role as a BH utilization management clinician allows me to support members as they navigate the healthcare system by collaborating with their providers to promote treatment and medication options. My role allows me to identify quality of care concerns and intervene as necessary to benefit our members.
Every day that I come into work, we're helping people. I'm a people leader, so I help them as well. And it just shows me how resilient people are, and that definitely shapes how I show up every day.
Career has changed me to have more patience, definitely to be optimistic.
It creates a profound shift in your perspective. You see how resilient and adaptable humans truly are when they have a guiding hand.
I would say social work has opened my eyes to trauma, hardship. It deepened my empathy, my compassion to others' situations.
I think I'm overall just more confident in what I can bring to the people that I work with. I also feel like I've learned a lot myself about how health and your living situation, the food that you have on your table, how all these things really interconnect with each other.
I definitely feel like I've changed. I've become a stronger advocate and speaker for my patients, but also really learning how to help them speak for themselves, both in the hospital setting as well as here at Metro Plus.
2 weeks ago, I left work on a Friday and I just felt so good because I was able to problem solve so many issues for and with my members, things that would have been major barriers. So it's definitely just so fulfilling.
The work taught me to be incredibly passionate with people, especially if they're in distress, that they are probably in a very difficult moment in their life, and not to take things personally, but treat as a motivation for you to work harder for them.